Welcome. In this session, we are going to look at the medial compartment of the thigh and the adductor canal. And by the end of this session, you should answer the following questions. What are the boundaries of the medial compartment of the thigh? What are the muscles of the medial compartment of the thigh? So for each muscle, know its origin, insertion, action, innervation. You should also know the adductor, also known as the SUBSARTORIAL, also known as the Hunter's Canal. Know its boundaries, contents, and maybe we'll say something about clinical correlation. So welcome all. My name is Wallace Munyere and I'm the Ure Daktari. So boundaries of the medial compartment of the thigh. So there is an anterior border and posterior border. So anterior border is the medial intermuscular septum, which this medial intermuscular septum is a modification of the fascia lata. And this medial intermuscular septum separates the medial compartment of the thigh from the anterior or the extensor compartment of the thigh. The other name of the medial compartment of the thigh is the adductor, A-D-D, adductor compartment of the thigh. Like this adductor compartment of the thigh. So the posterior border is by an ill-defined posterior intermuscular septum. In fact, we find some authorities suggesting that this posterior intermuscular septum is absent because muscles such as the posterior intermuscular septum is ill-defined and incomplete due to presence of a composite muscle. The composite muscle here is adductor magnus. It has both adductor component and the flexor component or the hamstring component. Okay, if you have looked in the video of the posterior aspect of the thigh, the hamstring muscles, you remember we had the adductor magnus. We considered it as part of the hamstrings, but it has the hamstring component and the adductor component. Okay, so due to that, it is found in both medial compartment and the posterior compartment. Okay, so the posterior boundary is ill-defined. The posterior intermuscular septum is ill-defined and incomplete. So here we are. This is the fascia lata in green, and you can see it is set in the septa. Okay, this is the femur. So here is this is the medial compartment. This is the medial intermuscular septum, the anterior boundary, which separates it from the extensor compartment or the anterior compartment, and the posterior intermuscular septum, which is incomplete and ill-defined, which separates it from the posterior compartment or the flexor compartment. Okay, and the nerve to the medial compartment is the obturator nerve. Okay, so muscles of the medial compartment. The muscles of the medial compartment are usually arranged in 3 layers from superficial to deep. These are, we have an anterior layer which consists of pectineus, adductor longus, and gracilis muscles. Then we have a middle layer which consists of adductor brevis muscle. Then we have a posterior layer which consists of adductor magnus muscle. Now these are the characteristics of the adductor muscles of the adductor component. All are innervated by obturator nerve. Okay, now if you remember when we were doing the lateral rotators of the thigh, we mentioned the obturator externus. So obturator externus, it's innervated by the posterior division of obturator nerve. Functionally it belongs to the gluteal region, but when you use this when you use this method, you can also consider it as belonging to the adductor component. But let's use functional, how they are functionally related. So obturator externus will belong to the gluteal region because it is a lateral rotator, the 6 lateral rotators of the thigh. Okay, then 2 muscles of the adductor component of the thigh, namely pectineus and adductor magnus, are composite muscles. Hence, they have dual innervations. Okay, so pectineus is innervated by both femoral and obturator nerve, where adductor magnus is innervated by obturator nerve, its posterior division, and the tibial component of sciatic nerve. Okay, so The adductor part is innervated by obturator nerve, the posterior division of obturator nerve, but the hamstring component of adductor magnus is innervated by the tibial component of sciatic nerve. So here we are. Let's look at each muscle: origin, insertion, nerve supply, and action. So one action which is common to all of them, all of them are hip adductors. Hip adductors. Okay, hip adductors. So adduction of the thigh at the hip. So let's start with pectineus, which is a flat quadrilateral muscle, and it's a composite muscle because dual innervation. It originates from the pecten pubis. You'll find other text calling the pecten pubis the pectinate line, pectineal line. We also have it also originates from the upper half of pectineal surface of the superior ramus of pubis, and also from the fascia covering the pectineus muscle to insert into a line which usually extend from the lesser trochanter to the linea aspera, innervated by two nerves, femoral nerve and the anterior division of obturator nerve. Action, adduction of the thigh at the hip. Adductor longus. It is a triangular muscle. It has a rounded tendon. It usually forms the medial part of the floor of the femoral triangle. And remember, also form the medial boundary of the femoral triangle. It originates from the body of pubis in the angle between pubic crest and the pubic symphysis. We will see that in a few. To originate into the middle third of linea aspera, innervated by the anterior division of obturator nerve, and it is a hip adductor and medial rotator of the thigh or the hip. So it immediately rotates the thigh at the hip joint. So, and an interesting thing about the adductor longus is that sometimes its rounded tendon of origin may get calcified and to form a bone, especially in horse riders. So it is that bone which some authorities might consider as a sesamoid bone is known as the rider's bone, and it is due to friction of the tendon of adductor longus with the horseback. So the tendon tends to be calcified, so to form the rider's bone. So maybe that you might see it. Adductor brevis is a triangular muscle line. Now, adductor brevis, remember, you said it is in the middle layer. So it will lie behind the pectineus and the adductor longus, which are in the anterior layer. It originates from the anterior surface of the body of pubis and the outer surface of the inferior ramus of pubis between gracilis and obturator externus to insert into a line extending from lesser trochanter to linea aspera and the upper half of linea aspera itself just lateral to the pectineus. So, and it's innervated by either divisions of the obturator nerve. If not innervated by anterior division, posterior division will do so. If not by posterior, anterior will do so. So it adducts the thigh. Adductor magnus, which is a composite muscle, and it is a large muscle, has two components, hamstring and the adductor component. Today we are looking at the adductor, which originates from the outer part of istiopubic ramus to insert into the medial margin of gluteal tuberosity, linea aspera, and the medial supracondyle line. The hamstring component is the one which inserts into the adductor tubercle. So the adductor part is innervated by the posterior division of obturator nerve, where the hamstring is innervated by the tibial component of sciatic nerve. And these are the function of the adductor part: adduction and medial rotation of the thigh, where the hamstring part is a weak extensor of the hip joint. Gracilis, I think, is the only muscle of this of the adductor component which is not inserted into the femur. It originates from the medial margin of lower half of the body of pubis, also from the adjoining anterior part of inferior ramus of pubis, and to insert into the upper medial surface of tibia between the insertion of sartorius in front and gracilis behind, and and the semitendinosus behind. So these, they have a common tendon of origin, the pes anserinus, which inserts into the medial surface of tibia. It's innervated by the anterior division of obturator nerve, and it adducts the thigh, also flexes and medially rotates the leg at the knee joint. So please remember pes anserinus, the arrangement of those muscles is SGS, S in front, sartorius in front, then gracilis, then semitendinosus. So these three muscles form the pes anserinus, and you will find other texts which usually refer them to as gyropes, ropes. Sorry, I can't writing with the mouse is very challenging. Gyropes. So this was an R. Gyropes. Okay. So if don't be surprised if you see some text calling those muscles like that. Then let's continue. Now here, pectineus is the pecten pubis here, origin. Then adductor longus at the angle between the pubic crest and the pubic symphysis there. Then gracilis here. Then we have adductor brevis here on the inferior ramus of pubis. Then here you can see the adductor magnus. This is the adductor part from the istiopubic ramus here. Okay, and okay, then let's look. These are mainly the origins. Then let's look at the insertions. Here we have pectineus. Okay, then adductor brevis here. There, then adductor longus, the middle 1/3 of linea aspera. Okay, then we have the adductor magnus all the way from here, all this, all that, or it has a linear insertion. This, okay. So please know these origins. You can pause the video here and look at them clearly. And so here we are. Let's look at some. Now these are the muscles themselves. This is sartorius. We are not interested with that. So this is the femoral triangle. Remember the medial boundary. This is formed by adductor longus. This must be adductor longus. Okay, this is adductor longus. Then here we have cut and reflected the sartorius to expose this, the adductor longus. And this, which muscle is this, which forms also the floor of the femoral triangle, that must be pectineus. Then deep to this both, this one in the anterior layer, together now with the gracilis here. This is gracilis. This is gracilis here. So deep to it in the middle layer, that is your adductor brevis. Okay. See adductor brevis. Okay. Okay. Now let's look here in the last here. Then maybe here to expose the adductor magnus in the posterior layer. Okay. Here above the, this was your adductor. This was your adductor longus. Then we divided it to expose the deeper muscles, like this one, deep to adductor longus, then you go adductor brevis, then adductor magnus. Okay, this is your sartorius. Gracilis. This is your gracilis, the most medial. Okay, yeah, also here the same. Yeah, you can see these are the muscles forming your femoral triangle. Iliopsoas most laterally. Now then pectineus. Okay. then your adductor longus, then deep to it, adductor brevis, then deep to adductor brevis, adductor magnus. And you can see here, this is the opening in the adductor magnus muscle, known as the adductor hiatus, which allow passage of vessels and nerves. Okay. So that was the medial compartment of the thigh. Now let's look at the adductor stroke subsartorial. Here there is an R. I've not indicated the R. Subsartorial canal. Now the adductor canal is an intermuscular tunnel situated in the medial side of the middle 1/3 of the thigh. I hope everyone knows what's a tunnel. It's like that tunnel along Thika Superhighway as you head towards Ngara, near past Muthaiga. But this does not branch like that one. So it is a tunnel. So you can see it will connect femoral triangle to the popliteal fossa. So that is a tunnel, just a tunnel. It usually extends from the apex of the femoral triangle above, okay, to the tendinous opening in the adductor magnus below. So from the apex of femoral triangle here to the adductor hiatus here. Okay. It provides passage of femoral vessels from femoral triangle to the popliteal fossa. Okay. So boundaries, this is a must know. So this is lateral, this is medial, this is posterior, this is anterior. Okay, maybe I should write that very fast. So this is lateral, this is medial, this is anterior here, and this is posterior down here. So with that, maybe you will understand first. So you can see this is this muscle vastus medialis. It is lying both anteriorly and laterally. So it is anterolateral. The anterolateral wall is formed by the vastus medialis. Then here, medially or the roof is formed by this. Medial is formed by this strong fibrous membrane stretching across the anterolateral and posterior boundaries. Now, then above this strong fibrous membrane, we have this muscle, sartorius muscle overlying. So you can see that tunnel is beneath sartorius, so subsartorial canal. Then posteriorly, or the floor is formed by two structures, adductor longus above or superiorly. Then as you go inferiorly, adductor magnus takes. So adductor longus above, then adductor magnus below. So please know those boundaries. You can see some of the contents. You have femoral vein, femoral artery, nerve to vastus medialis, saphenous nerve, and then just beneath the sartorius, but superficial to the strong fibrous membrane, you have these nerve plexus, the subsartorial plexus of nerves. So these are the contents: femoral artery, vein, saphenous nerve, nerve to vastus medialis. Then we have the anterior and posterior divisions of obturator nerve, but not a must. They occur occasionally. Then we have the descending genicular artery, which is a branch from the femoral artery. So here you can see, remember in the femoral triangle, this was lying medially, this laterally, but here you can see it is crossing. The artery is crossing the vein from lateral to medial. Why does this occur? Also the nerve, because during when you run the development of the limb, you'll see that the lower limb usually rotates 90 degrees medially. So as it rotates, this also occurs. So this, then you can see here we have the branch from my femoral artery, the descending genicular artery, which will give off two branches, the saphenous artery and the articular artery. And then you have this anterior division of obturator nerve will contribute in the formation of subsartorial plexus of nerves. Then the posterior division will go to supply intracapsular structures in the knee joint. And nerve to vastus medialis, as the word suggests. Then here we have the longest cutaneous nerve in the body, the saphenous nerve. It is the only cutaneous nerve from the posterior division of femoral nerve. So it will cross and it will supply the medial aspect of the leg. So subsartorial nerve plexus. The subsartorial nerve plexus lies on the roof underneath the sartorius. The plexus is formed by branches from the following nerves: medial cutaneous nerve of the thigh, the saphenous nerve, also from the anterior division of obturator nerve. It usually supplies the overlying fascia lata and the skin. Okay. Now here we are. We are trying to remove the sartorius. These sartorius should lie on the roof of the subsartorial canal. Here you can see we are trying to remove it. And here you can see this is the femoral artery. Here, this is the femoral vein. Here you can see the termination of the great saphenous vein. And you can see here the vein is medially in the femoral triangle, but here you can see the artery is crossing the vein from lateral and line medially to it. Okay, this is your adductor longus. Here you can see we have cut and removed the sartorius mass to expose now the contents. You can see here, this is the femoral artery. You can see it is passing through the adductor hiatus here to go into the popliteal fossa. And these are the nerves. Okay. So the femoral artery, the femoral vein might be lying posterior to this or lateral to this, to the femoral artery. So these are the answers to this diagram here. You can try to name each of these parts. Post the video, name each part, then you continue and see if you have if you can name them. Okay, that is division. Now clinical correlations. Now the clinical significance of the adductor canal. The femoral artery is usually exposed and ligated in the adductor canal during surgery for aneurysm of the popliteal artery. Remember, popliteal artery, as we said, it is the artery that has the greatest risk of developing aneurysm in the body. So where will you ligate the femoral artery? At the adductor canal. Now, this is because the artery at this side is healthy and does not tear when tied, okay? Which may occur if the artery is tied in the popliteal fossa immediately above the popliteal aneurysm. So you should tie that artery in the adductor canal, not in the popliteal fossa, because when you tie it in the popliteal fossa, occasionally it will tear, but not in the adductor canal. So this procedure was first performed by a famous surgeon, Dr. John Hunter. That is why the adductor canal was named after him, Hunter's Canal. Then we have what is also known as the adductor spasm of the thigh. Spasm of the adductors of the thigh in spastic paraplegia may be relieved by surgical division of the obturator nerve. So obturator nerve, as it exits the obturator canal by surgical division of that nerve, you might relieve spasm of the adductor spasm of the thigh. So thank you for your attention, and please subscribe for more anatomy and biochemistry content. And thank you for your time.